Hi, Salicia. Hi, Peggy.
Hello.
Hi. Thank you for jumping on this call with me and taking some time to talk about the conference.
Mhm.
Um, and really appreciate your involvement and being willing to be a part of the conference, mainly because I think you're bringing the only really expressive aspect to the conference. So I'm really excited about that. And so the idea for this is on day two, people will have a choice of choosing one of five day-long workshops to attend, or people can get the full conference. But this will give, if you could talk a little bit about one, just introduce yourself, talk a little bit about IFS and your experience with IFS in the eating disorder world and with art therapy, and then what the day's going to look like. Yeah.
Oh, great. Love to. You want to start, Celicia?
Yeah. Hi, everyone. I'm Salicia Mazero. I thank you for having me back this year. I was very excited to present in person last year. So I am a registered art therapist. I'm a licensed professional counselor. I actually practice in St. Louis, Missouri, and I'm a certified eating disorder specialist and supervisor for CEDS. So my practice, majority of my practice is eating disorder clients. And I've been treating eating disorders for the last 13 years using IFS in that and also pulling art into working with my clients. So this is an area I'm very passionate about. Both Peggy and I have been working together since 2016, incorporating IFS, art therapy, some sprinkling, some EMDR. So we've written a chapter together. We're currently working on a book proposal for a workbook. So yeah, this is kind of exciting to be able to work with her on this.
Nice. I immediately want to know more about the workbook. Yeah, is
Okay.
it going to be geared towards people in recovery or
It's more general. It's an IFS or an art IFS informed art therapy. So, and since it's a proposal and it's not quite, even though it's 75% written, it hasn't quite been approved yet. So we really can't speak more about it other
or
than it is coming.
yay, exciting,
And
exciting.
hopefully by the time of the conference, we might know more.
Right,
Um,
Right.
so yeah.
right.
We have a great collaboration. I mean, we're writing the proposal. They wanted two chapters for the proposal. We've written 75% of the book already. I
I'm
mean, once we started, we have a great flow together, and I
so
hope
nice.
that comes across in the workshop that we teach. We're often complimented on because two people teaching a workshop and that kind of collaboration can look differently, but
Exactly.
flow. Yeah. So I'm Peggy Kolodny. I'm a art therapist, over 40 years, graduated from GW. I am board certified, registered, and in Maryland, we become licensed as art therapists. So I'm a licensed clinical LCPAT professional art therapist, and we are licensed through the counseling board. So our own license gives us the ability to diagnose,
Hmm.
treat, be reimbursed by insurance, and everything we do is commensurate with any other licensed mental health profession. So we want to make that clear in this workshop as well, that we are a profession, but here we are teaching an ethical and effective way of bringing in creative modalities into work, integrated with IFS and into the work with the eating disorders. I'm a trauma therapist. I really am a pioneer in the trauma work because I've been doing trauma work since an intern in 1981. And in the 80s, became part of the Central Maryland Sex Abuse Treatment Task Force. I've really been fortunate to be in the beginnings of all the trauma theory attending conferences. And I emphasize that because that's my specialization. But we know that many people with trauma have, I would say, beyond comorbidities, they have a lot of other diagnoses, addictions, eating disorders among them. So while I'm not the primary therapist beginning with an eating disorder, I am the therapist working on the trauma aspect that's comorbid with um, eating disorders. So by the time someone comes to me with addictions and eating disorders, they've already have begun their treatment, and I'm part of that journey. So while I may be the primary therapist, I work in collaboration with their nutrition, their psychiatrist, their addictions counselor. And I got trained in IFS up to level 2. And immediately in the training, I was sitting here going, you could do art here, you could do art here, because that's the way our brains work, right? I'm
Yeah.
trained in EMDR as well, and the same thing happens. So integrative approaches we know are very effective in trauma work and eating disorders. So we are encouraging that. And to also part of this workshop that if you have other approaches, theories, they integrate well with IFS and art therapy. I'm also on the faculty of the Florida State University, where I teach a course on neuroscience and trauma with art therapy, using art therapy, and guest lecture and other faculties throughout the year. So a lot of teaching.
That's
Yeah.
great. Did you say that was in Florida?
Yes, it's virtual. I'm in Maryland. I should mention that. I'm in Baltimore, Maryland, but it's a in the art therapy graduate program, so we teach virtually.
Got
I
it.
also teach part of the trauma track at George Washington University's art therapy program. I have a private practice and work full time still.
And
Yes.
you teach, we both teach at the Ference Institute together, Lisa
Yes.
Ference.
The Ference Institute is a local institute, but they teach globally because they offer in-person virtual, and you receive a certificate in training. So we're on that faculty. And yeah, that and we teach for, some other workshops as well. There's the Expressive Therapy Summit. So we could easily be teaching a workshop every month.
Yeah. It's amazing. Yeah.
And we both work with dissociation and dissociative identity disorders too. So just want to
Yeah.
emphasize that. So in this workshop, it's coming from a trauma-informed perspective.
Yeah. So can you tell me a little bit about what people can expect for the five
Yeah.
hours?
Yeah, so in the 5 hour workshop, we're going to be sprinkling in more art into it. So you don't have to be an art therapist to attend this. If you are a therapist or a clinician that tends to pull art into your work, or you're trying to think about how else can I connect with my clients in a low verbal or nonverbal way, this is perfect, right? So we will go over some ethics of how to do art therapy with a client when you're not an art therapist. And then we also look at, how does art overlap or art therapy overlaps with IFS? Because there's a huge amount of overlaps, especially even overlaps using the 6 Fs and the 8 Cs. So what we try to do is in the morning portion of it, you'll be doing a collaging of a part, and then we work on enhancing and understanding that part as the training goes on, and the afternoon portion will be a clay experiential. So Peggy, I don't know if you want to add more to the
I
experientials.
I do because the way the day's structured, we're using art as a teaching tool. So you're not just, using talk to in a lecture form to teach about it. They can really embody it and experience this through the art, and they can see from the beginning how effective it is. So the collage aspect is how we teach the 6 Fs. And the clay aspect is delving into learning a part, getting to know a part. And it's important to know that obviously we're not teaching IFS for them to leave the 5 hour workshop and start using it. IFS, really takes the level 1 takes months, but we're giving an overview and an understanding, and whatever art techniques we discuss, they can immediately use because they're pretty broad.
Yeah.
And we're teaching enough about IFS that works organically with whatever theory, because IFS really is a way of understanding we have parts and how to get to know them. That's really it, in understanding roles, and that's useful in any of our therapeutic work
Yeah.
without going deeper. So that's an important piece.
Yeah. This sounds amazing. So for since this is virtual, how will people be collaging and doing the clay work and how will that
Yeah,
all
so
work?
before the presentation, you guys will get a list of art materials that we suggest that you have before before the workshop. So like magazines, even with collaging found objects, things that you have around your house, it's very easy to kind of pick stuff up to collage with. And then for the clay making, we will give some suggestions of what type of clay we like using with our clients or what we would recommend that you have in your office. And then if you don't have that, Peggy also has a way of how to make clay using flour and
And
whatever you have in your kitchen.
flour and
She's
water.
figured it out. Yep.
Yes, because we often find, and we're all guilty of this, that we come to a workshop, we had the list of preps, and we're rushed, and it's like, oh, I forgot to get this. And
Yeah.
since the afternoons with clay, we want to make sure during lunch break you can go and make your own clay if you haven't accessed it
Yeah.
or haven't bought it. So we're prepared. And it's an important point in this economy too, in budgets. I like to give the recipe because, expecting people to buy supplies can be expensive. So it's very inclusive to say, here's a budget-friendly way of having art supplies.
That's great. That's really, really good. And so people can choose to attend this live, interactive, and then I'm guessing this would also work if somebody is wanting to get the recorded version.
Oh,
Oh,
definitely. Yeah.
absolutely. Yes. And people have used like the clay uh, um, experiential that we're presenting. It can be easily used for sand tray as well, with miniatures in the sand. So it can be applied with different media. So we make that point as well.
That's amazing. I'm like so excited about this conference and about your workshop. I knew what you were going to be doing, but to hear what you're really going to be doing, I am super excited about it. Anything else you want to say before we close?
Sure, because this is about eating disorders. I think looking at any sensory, somatic embodying
Mhm.
of the work we do in therapy is really deepening the understanding and enhancing the effectiveness of it. We're not just talking, they're doing and they're creating. And art brings a playfulness that makes understanding this really complex issues and the conflicts within, it makes it softer and less threatening.
Thank you both. I really appreciate you and looking forward to April.
Yeah,
Great. So are we.
we're
Make it more
excited.
exciting. Yeah.
Take care.